Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal, and we have a guest today.
I'm Andrea, I'm the physio.
So in today's episode, we're going to be talking about physiotherapy, not only before, but during and after your visit to the hospital after a total knee replacement.
I am really excited about this video because it's going to be so useful to have a video we can refer our patients to. Because they often ask me, say, well, what exercise should I do? And I'm like, ask your physio. So now we're asking the physio.
So this is going to be our primary resource to get people ready for a total knee replacement. So Andrea, what do you tell people when they first come to you about prehab?
So normally we try to get people to practice the exercises that they're going to be doing here before they come in for their surgery, so that way they can be familiar with what they're going to be doing. An exercise sheet for total knees. Do you guys want a little demo?
That'd be awesome.
I think it's a great idea.
Perfect.
Okay, so we're going to move over to an examining table and do a little demo of some exercises that you can do before your knee replacement. Okay, so here we are with Dr. Wiening as our pre-total knee patient and Andrea the physio, and we're just going to demonstrate some exercises to do before your knee replacement.
So it's really important to strengthen your quads muscles before you have your knee done. So the first one, it's pretty simple. It's basically just keeping your legs straight on a bed and pushing the back of your knee down into the bed and tightening your top muscle. You hold it for about 5 seconds and then you relax. You do that one about 10 times. Pretty easy. The second one is it's a straight leg raise. So you're gonna raise your leg about 6 inches off the bed, hold it for 5 seconds, and then let it back down. This one's gonna be the toughest one to do after surgery because your leg is gonna probably feel like cement. So I would practice that one a lot more. The third one, this is two rolled up towels. You can always take like an apple juice can or a coffee can and put a towel around it and tape it so you can have it at home. This is gonna go under your knee, and then keep the back of your knee on the roll, and then you just lift here. Hold it for 5 seconds, and then let it down. Those are the main ones that we do. If you have a problem with your knee extension, meaning it doesn't straighten all the way, the other one we would practice was here. So you just leave your heel on the roll, and then you just let your knee relax down, and you leave it there for about 5 to 10 minutes for whatever you can tolerate. And that helps straighten the knee out totally.
And that's a really good point because a lot of people with advanced arthritis slowly develop what's called a flexion contracture. So you'll notice rather than lying on a bed like this, you'll start to go like this, then your heel comes up. It will never go totally straight until you've had your operation. So that's a very common problem.
Okay, so these exercises look pretty straightforward. I hope if you were worried about physio and how hard it would be, you can see that it's not really complicated exercises that you have to do, but really some simple exercises, but they make such a huge difference. Now, Andrea, is knowing what the exercises are just as good as doing the exercises?
No, doing is obviously a lot better than just knowing.
Anybody can know the exercises. The key is to actually do the exercise.
Okay, Seinfeld. Yeah, and we talk about this all the time with our patients. It's just like when in any injury, going to physio does not make the difference, but it's doing the physiotherapy. So you have to do it, and you can't really do it too much. I tell people pain and common sense are your limitations.
I like what you tell people after you say, okay, I've done the surgery now.
I'm a cheerleader. That's all I can do is cheer you on because I cannot do the exercises for you.
I think you should follow that up with, here's a T, here's a K, here's an R, TKR. That's who you are.
There you go.
We usually recommend these 3 times a day. If it's too easy, do it 4.
Okay, so that's what you're going to be doing before you come in for your knee replacement.
Right.
So now let's say you've had your knee replacement, you're in the hospital. Are the exercises much different?
The exercises are the same. The only added thing we put in is when you first get up, you start pumping your ankles. So this helps increase the blood flow in your leg because we don't want you to get a blood clot, and deep breathing exercises hourly. And that's the only difference. We add in those 2.
Yeah, and often we tell people that too. So 10 deep breaths an hour. It's a good way to expand the bottom parts of your lungs that sometimes can collapse with surgery and increase your risk of getting pneumonia. So we want to try to avoid that as well.
So there is some stuff you have to do. And what I tell people is they'll often say after, oh, thank you so much for my knee replacement, thank you. I say, listen, I did the easy part. That was doing the operation. The hard part is recovering from the operation. And all these things are key in your recovery. And now now we've done the exercises, you're leading up to the surgery, you're in the hospital, you've done your exercises, and now you go home. What do you do after your knee replacement when you go home?
So what happens when you come to the hospital is we will ask you about what your plans for the outpatient therapy are. You have the option of coming to our hospital. You can choose to go to a private clinic. Anywhere you want to go, you can go. But the key is to start as early as possible. We've had some patients start the next day after they leave. Ideally, within a couple of days of you getting discharged, you go to outpatient physio. This is really important because you actually have to get up, get dressed, walk to your transportation, walk into your physiotherapist's office, and that in itself is physio as well. I know in the past, home care physio used to be a big thing, but you're basically at home, people are coming to you, and you're not doing as much for yourself as you would be if you're going to outpatient physio. We've also had some issues with people having an appointment and canceling it right away because they're having pain. It's so important to make that first appointment and actually go to it because they'll do things for you that will help with your pain. So I know it's tough, but again, it's so important to go to that outpatient physio immediately after your surgery.
And I get it. It is tough. It is hard to get motivated. Last night, I was planning to work out with one of my children. Instead, I watched the hockey game and ate a bag of chips. It happens. But the difference is, with your regular exercise routine, if you don't do it today, you can do it tomorrow. With knee replacement physiotherapy afterwards, there is a window.
And I tell people it is a rapidly closing window.
Yes.
Yeah, we don't have a lot of fancy graphics. This is our fancy graphics for rapidly closing window. It's rapidly closing. How many weeks would you say you get your most benefit from?
I say I really want most of it in the first 6 weeks. As much as you can get it to 3 months and even to 1 year, 6 weeks, the lion's share of your range of motion is going to be there.
I totally agree. And that first 6 weeks is key. If you try and do no physio for the first 6 weeks and then come in at 6 weeks and try and do some physio and get it going, you are really starting at a disadvantage and you will almost 100% sure not get as good a result as if you started right away after your knee replacement.
And like Andrea said, controlling your pain is critical, and that's why Paul and I have done other videos where we talked about please take your medication. Don't worry about being addicted. Take them responsibly. But if you don't take your pills, you're too sore, and then you can't do your physio, and your therapist will be not only frustrated but also helpless. So you have to take the pills, you have to ice, you have to elevate to control the swelling and the pain.
That is a good point. Dr. Winnie mentioned addiction with opioids. That is a big topic right now. We do have a video about pain control and multimodal pain control and the issues with opioids. But when you're in a lot of pain and you take the opioids, it's an appropriate use of the opioids, in my opinion.
Yes, 100%.
Obviously, once you're no longer in pain and once you're several weeks or months away, then you're not going to be using opioids at that point. But definitely in the early period, if you need them to get your physio done, it's an important part of your pain. So another exercise you can do at home after your knee replacement is aimed at getting knee range of motion. Andrea, can you show us something we can do at home to get knee range of motion?
So bending is very important to start immediately after surgery. So there's several ways that you can work on your bending. Usually sitting in a chair or sitting on the side of your bed works. If you can get your foot on the floor is even better. So what we've done is we put a towel down on the floor so that your foot can slide a little bit easier, and then a towel underneath your thigh. So you gently lift here, and then you try to slide your foot back. So you just unweight the foot a little bit and slide back as far as you can. If you want to add a little bit of oomph to it, you take your unoperated leg and cross it over the front, and you use it to push back even further.
I like the oomph. If you're one of my patients, you've seen me say this, heard me say this a lot, is get that other foot in front and pull back, pull back, pull back. Should it hurt when you do this, or should it be completely pain-free?
It should hurt. If it doesn't hurt, you're not pushing it far enough. The third way...
You're mean.
Well, see, you would rather have me bending your knee than one of these two because I'm a lot nicer than they are. So.
And I always tell people too, if you're not on the brink of tears, you're probably not working hard enough. And if you like your therapist too much, they're probably not hard enough for you. You need to not like them a little bit, for sure.
Yeah, I mean, it seems harsh to say this, but it really is a no pain, no gain situation. That's cliche, I know, but I tell people it's like training for a marathon. Nobody who's trained for a marathon said it felt great during the training. You're going to feel some discomfort during your training. This is just like training for a marathon to get your knee to work.
It also sounds like parenting.
A little. Okay, sorry to interrupt.
It's okay. So the third way to work on your bend, you can take the towel away.
Okay.
I'll take the towel away from here. Is just plant your foot on the floor and start inching your bottom forward. the key is keep your bottom on the chair. Don't lift up because that makes your knee bend less. If you have someone at home, you can have them stick their foot in front of you so that you don't move the foot and cheat.
I think that's a great one. And I tell my patients to do that all the time. And sometimes if they're on their own, I tell them to have their chair facing a wall. So the wall can be like that foot. Then they slide forward, hold it as long as they can, and then they get to relieve it by sitting back in the chair. I think that's an awesome one.
If you guys have any great ideas, if you've had your knee replaced and you have some neat knee bending exercises, please put them in the comments for other people to see too.
Absolutely.
And it really is key. That knee wants to get stiff. I think of it like you had an old car in there. We just gave you a new car. It's going to look great, but if you don't put gas in it, it's not going to go anywhere. The physiotherapy is the gas to get your knee going.
Excellent.
Question.
When people are home and they're like, well, when can I get onto a cane? Because a lot of my younger patients are so keen to get on a cane so quickly, even when they can barely walk. What do you guys advise them?
Yeah, it's really important not to move from a walker to a cane too early, especially if you're not walking well with the walker. The whole purpose of the walker is to sort of unweight your leg a little bit until it's strong enough to make you walk properly. So there is no real answer to when you can move from a walker to a cane. Everybody's different, but your physiotherapist will advise you when you're ready for that.
Andrea, thank you so much. This was a really, really helpful video. It was helpful for me to see the exercise so I can guide people along too, but it is really important to consult the physiotherapist, and we really appreciate your time.
So please keep your comments coming. If you liked it, please like it and subscribe to our channel.
And remember, you are in charge of your own health and your own physiotherapy.
We'll see you next time.